Did you know that there are people that take drugs to not get high? Colorado just became the first state to cap the price of insulin to $100 per month. This means that diabetics don't have to pay over $100 a month on insulin alone. This is helpful because the amount of money a diabetic spends on the care alone is ridiculous. Insulin's drug pricing problem is much larger than anything a state or drug company alone can fix. I have been a type 1 diabetic for over a year and have seen the effects in my own personal life. I have seen the financial and dosing changes I have taken in order to save insulin for a longer amount of time. People are rationalizing their insulin and are risking death because the price of insulin is too expensive. This is dangerous because they aren't taking proper care of themselves. Colorado just realized that insulin is ridiculously overpriced, pharmacies and drug companies are manipulating their consumers, and diabetics need reasonably priced access to insulin. The background and history of insulin is the most important reason as to why the price is the way it is now. According to Vox in 1923, Frederick Banting, inventor of insulin, refused to put his name on the patent. Later on in the article, it explains how he felt as if it was immoral for a doctor to make money from something that would save lives. When insulin was first discovered, it was much cheaper and patients could afford to pay for insulin out of pocket. Within the past decade, insulin has tripled. Insulin prices have more than doubled since 2012, which is why it is such a big deal that Colorado has become the first to cap the insulin prices. According to Dr. Ciani, before insulin shots were developed almost 100 years ago, a diabetes diagnosis was a virtual death sentence. With the discovery of insulin, it's a miracle that saved countless lives. The current cost of insulin has put people's lives on the line due to congressional debates with large drug manufacturers. CNN has interviewed a lady who takes a drastic decreased amount of insulin because she can't afford the proper care. Diabetics have to take insulin to live. If we don't have the proper amount, our blood sugar goes high and we could suffer from an early death if our blood glucose level is high for too long. There's this family, the Smith-Holt family to be exact. Nicole, the mom, and her son Alec. Last year, simply because he could not afford insurance, when Alec found out that the only affordable insurance plan required him to pay a whole $7,600 deductible before he could fill his insulin prescription, he decided going without insurance and paying out of pocket for his insulin would be cheaper. As he waits for his paycheck, his family believes that he's rationing his insulin. As I have said previous times, this is dangerous. Sable Smith writes, he died less than 1 month after going off his mother's insurance. His family thinks he was rationing his insulin, which means he is using less than he needed, to try to make it last until he could afford to buy more. He died alone in his apartment 3 days before his payday. The insulin pen he used to give himself shots was empty. These kind of horrible things are becoming more and more common as time goes on. 1 in every 4 patients with type 1 has had to ration their insulin due to cost. Insulin is not optional. Insulin is a life or death situation. People have to forego their insulin dosage or completely skip a dosage just to survive and manage their own finances. Diabetics can't afford to ration their medications. They take their medications to survive and maintain quality health. Blood glucose levels affect more than someone's health. It affects their mentality, sanity, emotions, relationships, and friendships. Type 1 diabetes is already a hard obstacle in life. We, as diabetics, shouldn't have to worry about not being able to afford our medications. Insulin has been found to be way cheaper in Canada and Mexico. Therefore, people are crossing borders to buy insulin from these countries. People travel miles and miles to try and get the cheapest insulin they can. According to Type 1 Diabetic or T1D International, in Mexico you do not need a prescription to buy insulin compared to the United States. In the United States, you need a prescription that was verified by your doctor before you can ever purchase it. Further down in the article on T1D International, it talks about Canada's insulin price. In Canada, Novolog, a fast-acting insulin, costs $30 a vial compared to $300 in the United States. Not to mention that there is no generic brand of insulin, but there are rebranded insulins. If you are prescribed a specific type of insulin, you have to use that type of insulin. Simply using a different type of insulin could affect your blood glucose levels. Throughout my speech, I discussed the background and history of insulin and its prices, the current costs and congressional debates with large drug manufacturers, and how insulin is being rationed for life or death and how it isn't optional, and how diabetics are crossing Canadian and Mexican borders to purchase cheaper insulin. For type 1 diabetics such as me, insulin is like oxygen. I need it to survive. I have a dead organ. In order for me to survive without that organ, I need to purchase insulin regardless of how much it costs. Type 1 diabetics would only survive about 4 to 10 days without insulin. What can you do to help? I encourage you to please contact our lawmakers and get involved with the fight to reduce costs and make insulin affordable to all. You can join your local chapter. According to T1D International, your T1D International chapter will provide the support you need to get going. They can help you with a group of like-minded people fighting for the same things, as well as resources, tips, and reaching out to legislators, and more. You can also contact your representatives. This means reaching out to your senators, your congressional representatives, and your state representatives. You can write to them directly or call, but if you call, make sure you ask to speak to a legislative aide or staffer who works on health policy. All these ways are ways you can make a change.